Welcome to Is Parkinson's Preventable webinar with Dr. Ray Dorsey. Dr. Ray Dorsey is the David M. Levy Professor of Neurology at the University of Rochester. He is working to identify and eliminate the root causes of Parkinson's disease. His research on brain diseases and digital health has been published in leading academic journals, been featured in multiple news outlets. In 2020, which many of you may be aware of, he and his colleagues wrote Ending Parkinson's Disease. It's a book that outlines a prescription for ending the world's fastest growing brain disease. And he's showing the book. Dr. Dorsey will speak of that during this interview, and there will be time for questions. Thank you so much for joining us, everyone. He also previously directed the Movement Disorders Division in Neurology Telemedicine at Johns Hopkins. He was recognized by the White House in 2015, not 1995, 2015, the champion for change for Parkinson's disease. Dr. Ray Dorsey, without further ado, you've been a wonderful friend of Parkinson Foundation, Western Pennsylvania. Thank you very much. I'm going to just delve right into the interview. Can you please share a little more about your background regarding Parkinson's and how you became involved in this research, looking at the environmental contributors to Parkinson's?
So first of all, thank you for joining. Thank you very much for all the efforts that you do. It is people like you that will change the course of this disease, just like people did it for polio, just like people did it for HIV, and just like people did it for drunk driving. So as an academic, I had the gift of a sabbatical in 2018 or so, and I spent the better part, a large part of that sabbatical reading the great work of Dr. Caroline Tanner, a fellow Parkinson's specialist who has a PhD in epidemiology from Berkeley. And she has quietly, in a very understated way, been telling us that Parkinson's is preventable. She's been telling this to us for at least 40 years. And it's time that we listen to the great work that she has done. And the more I read, the more convinced I became, and that motivated me to join my colleagues, Drs. Michael Oken, Todd Scheer, former CEO of the Michael J. Fox Foundation, Bas Bloem from the Netherlands, to write the book Ending Parkinson's Disease, in which we argued that Parkinson's disease is, for the vast majority of people, a man-made disease. And I've only become more convinced of that notion in the 4 years since writing that book, and we're working on a sequel to make that point even more clear, that Parkinson's disease, the world's fastest growing brain disease, is largely preventable.
Thank you. And I will include the link to purchase this book in the chat. Dr. Dorsey, can you please share your thoughts on why Parkinson's is the fastest growing neurological disease?
Yeah, everyone calls me Ray.
Ray, okay, Ray.
So the Global Burden of Disease study maps out different diseases, and in 2016 or 15 identified that brain diseases are the world's leading source of disability. So more people are disabled by brain diseases than by cancer, than by heart disease, than by infectious diseases, than by COVID, than anything else. And of those brain diseases, the fastest growing is Parkinson's, faster than Alzheimer's, faster than ALS, faster than any other epilepsy, migraine, stroke, and the large line. And obviously, aging has something to do with it, but this growth is even faster than aging can be explained alone. And I think it's due to environmental factors, chemicals in our food, water, and air that are fueling this rise. And if you look at the rates of Parkinson's in the world, and even in the US, it's not uniform. If it were just purely genetics or purely aging, it would correspond to genetic differences in the US population or world population and to aging, and it doesn't. It correlates to industrialization. So the areas of the world that are most industrialized, like the US and Canada, have 5 times higher rates of Parkinson's disease than areas of the world that are least industrialized, like sub-Saharan Africa. By the way, the opposite is true for stroke. Rates of stroke are higher in sub-Saharan Africa than in the US, for example. So it's not just diagnosis. And areas of the world undergoing the most rapid industrialization, like India and China, had the fastest increasing rates of the disease. And we've known this for a long period of time. A study done in Canada in 1980s showed that in rural areas of Canada, the incidence, the number of new cases of Parkinson's disease, is almost perfectly correlated with pesticide use. The correlation coefficient goes from 0 to 1, then 1's a perfect correlation, and the correlation coefficient was 0.967. So near perfect correlation between rates of pesticide use and incidence of Parkinson's disease done in Canada. Same study's been replicated in Israel. Same study's been replicated in France. So we know from a wide range of evidence that chemicals in our food, water, and air are, for the vast majority of people with Parkinson's disease, fueling its rise. And if we get rid of these chemicals in our food, water, and air, we can get rid of Parkinson's disease.
Thank you. Ray, can you please elaborate on these particular chemicals that are very harmful for people that may have developed Parkinson's or may contribute to the development of Parkinson's?
So yeah, I think there are three big ones for people living in the U.S. The first is are certain pesticides, especially a pesticide called paraquat. Paraquat's a weed killer. It kills the weeds that Roundup doesn't. It's been used since the 1960s. It's so toxic that the EPA says that one sip can kill. It's been used to commit homicide and suicide in over 50 countries, including China and England, which produce the chemical. So China and England are where the chemical is produced. They ban its use in their countries, but they export it to other countries, including the United States. I'll say that again. England bans the use of this weed killer because it's harmful to its population, but has no problem exporting it to the United States. And the EPA reauthorized its use despite protests and lawsuits, in large part supported by the Michael J. Fox Foundation, reauthorized its use in 2024, this year. And so we need, as a community, get our voices heard, tell our policymakers that this is unacceptable, and ban this weed killer, which is used on farms in Pennsylvania. It's used in farms in Western New York, near where I'm sitting right now. So that we get fewer cases of Parkinson's disease in the future. The second one is actually a dry cleaning chemical. It's called trichloroethylene. It's really simple. It's got 6 atoms. So many of you know that water, H2O, is 3 atoms. It's got a whopping 6, 2 carbon atoms in black, 1 hydrogen in white, and 3 chlorine atoms in green. It's got a closely related chemical called perchloroethylene that has a 4th chlorine atom instead of a hydrogen atom. It's been used to everything from dry clean clothes to degrease metal to decaffeinate coffee. If you drank decaffeinated coffee in the 1970s, you were likely exposed to this. And it's everywhere. It's in Western Pennsylvania. It's in Western New York. It contaminates up to 30% of the groundwater in the United States. It contaminated the drinking water at Camp Lejeune, the Marine base in North Carolina, where Marines who served there when they were young had 30 years later had a 70% increased risk of developing Parkinson's disease. And that's why you see all these advertisements about Camp Lejeune, because the Marines in the latter years knowingly exposed the best and brightest Americans to a cancer-causing chemical that's associated with a 500% increased risk of Parkinson's disease, and really did nothing about it.
Wow.
And it's everywhere. And like radon, which can evaporate from your soil and into your basements, many of you have had your home tested for radon. Trichloroethylene can evaporate from contaminated groundwater and soil and enter people's homes and cause cancer and likely cause Parkinson's disease. And the third major risk factor is air pollution. Outdoor air pollution like that from the Canadian wildfires is really harmful. If you want to live a short, unhealthy life, breathe polluted air. Increasing studies have linked Parkinson's disease to air pollution, and air pollution even more so to Alzheimer's disease. So certain pesticides, dry cleaning chemicals, and air pollution. If you want to avoid getting Parkinson's disease, or perhaps even slow your rate of progression of Parkinson's disease, minimize your exposure to pesticides, minimize your exposure to dry cleaning chemicals, and minimize your exposure to outdoor and indoor air pollution.
Thank you. So in addition to advocating and talking with your legislators, are there other ways to manage and reduce eating organic, air purifiers? Can you please share what we can do as a community and as individuals to lessen the risks?
Yeah, so Michael and Ogun and I are writing a sequel to this book right now. And in the sequel, called The Parkinson's Plan, is going to be the Parkinson's 25 things that individuals can do to lower their risk of Parkinson's disease. And if you already have Parkinson's disease, these are 25 things that may slow the rate of progression of Parkinson's disease. As an overview, if a smoker gets diagnosed with lung cancer, what's the first thing we're going to tell the smoker?
Quit smoking.
Stop smoking. But when a farmer gets diagnosed with Parkinson's disease, what's the first thing we tell them? We don't tell them to do anything differently. So you should avoid, if you have Parkinson's disease, you should avoid pesticides like the plague. Turns out not all pesticides are linked to Parkinson's disease, but I avoid all the pesticides like the plague. So I buy organic. I wash all my fruits and vegetables, even the organic ones, with a pesticide wash, vegetable wash. You can get one from Trader Joe's, and water. I put a carbon filter on my water faucets to decrease the exposure to chemicals that are in the water, like trichloroethylene. If I had a well, I would test my water, well water. It turns out the Safe Drinking Water Act only covers municipal water and not the well water that 1 in 8 Americans get their water from. And I would specifically have it tested for pesticides and chemicals like trichloroethylene. I'd wear a helmet. When I bike to work. I wear a helmet. If I ski or do anything at high risk of head trauma, I would wear a helmet. I minimize dry cleaning, and I use a dry cleaner that does not use trichloroethylene or perchloroethylene. You can usually identify these dry cleaners that usually have a green leaf, because they know that many of them know that these chemicals are dangerous. They're so dangerous that the EPA said that both these chemicals pose an unreasonable risk to human health and proposed banning them last year. But there are thousands of contaminated sites. Pesticides aren't just in our food, they're on our yard. So we have lots of dandelions in our yard because we don't use pesticides. Pesticides are on golf courses, so I would be a little bit worried about that. There are some studies that suggest living downwind of a golf course may increase your risk of Parkinson's disease. If I lived in a heavily polluted area, I'd get an air purifier for my home, especially my kitchen and bedroom where I spend a lot of time. When I drive through traffic, I roll up the windows and I recirculate the air in my car. So there are lots and lots of things that we can do as individuals to decrease our risk of getting Parkinson's disease in the first place, and to perhaps slow the rate of the disease, in addition to exercise and diet, Mediterranean diet and the like. These are all things that we can do, but fundamentally, the health we enjoy is a function of our environment, and our environment is largely dictated by societal decisions. So we need societal actions to take root to change the course of this terrible disease.
Thank you. Those are very helpful steps. Can you just share a little bit about, you mentioned about the other 2 risk factors, age and genetics. How do you think those play into the environmental risk?
So in 1880s, 1890s, a British neurologist named Sir William Gowers wrote the Bible of Neurology, and he described the 100+ people that he had been caring for with Parkinson's disease, and he said 15% of these individuals have a family history of the disease. And numerous studies since then have said that 15 to 20% of people with Parkinson's disease don't have a family history of the disease. Said another way, 80% don't. So 80% have nothing to do with their families, strongly suggesting that genetics plays a very small role in the disease. And it turns out that numerous studies since then have demonstrated that only about 15% of people have a genetic cause or genetic risk factor for the disease. A purely genetic cause of the disease, you have the genetic mutation, a mutation in 2 different genes, and you develop Parkinson's disease, accounts for 1% of people with Parkinson's disease. So 99% of people have to rely on some environmental exposure, likely combined with a gene for the disease, to become manifest. The most common genetic cause of Parkinson's disease is a mutation in a gene called LRRK2, LRRK2, more common in Ashkenazi Jews. And that's accounts for 2 to 3% of people with Parkinson's disease. And if you carry that genetic cause, that mutation, your lifelong risk of developing Parkinson's disease is on the order of 40%. Said another way, most people with the most common genetic cause of Parkinson's disease don't develop the disease. The most common genetic risk factor for Parkinson's disease is a mutation in a gene called GBA. And about 10% of people with that genetic mutation will develop the disease. So even among the 15% of people with a genetic cause or genetic risk factor for Parkinson's disease, the vast majority of those individuals will never develop the disease. Now, aging is important. So you don't get exposed to pesticides or these dry cleaning chemicals like at Camp Lejeune and develop Parkinson's the next day. Indeed, if all those Marines at Camp Lejeune had all died at age 40, almost none of them would have developed Parkinson's disease. Because we know that it takes years, if not decades, if not generations, for the disease to become manifest. It's just like smoking and cigarettes. You don't smoke a cigarette and develop lung cancer the next day. You have to smoke cigarettes for some period of time. You need to have exposure to these chemicals for some period of time, likely. And then there is a lag, a lapse between the exposure and the development of the disease that is likely measured in years, decades, or generations. So you have to live to a relatively long period of time for the disease to become manifest, because it takes years for the disease to spread, likely from the nose or the gut, and then to kill off sufficient number of brain cells for tremor and slowness of movement to become present.
Thank you. Have there been, or what type of research studies have been done to look at these environmental contributors and Parkinson's? And have you studied the under-engaged minority communities?
So there's been way too little research being done to evaluate this. The total number of studies, if you look in the US Library of Medicine, the total number of studies that evaluating trichloroethylene in Parkinson's disease is something like 41. 41 studies over like 50 years is like nothing. And so we need to invest a tremendous amount more in identifying and eliminating the environmental causes of Parkinson's disease. And that's what we're proposing to do by creating a center focused on the brain and the environment, to rapidly advance our knowledge base, to rapidly educate people, including policymakers, people with the disease, clinicians, and others about the preventable nature of Parkinson's disease, and advocate for policies to get rid of it. So we need far more research studies. And Casey, what was the second part of your question?
The second part is, have you studied the under-engaged minority communities?
Yeah, so it turns out, not terribly surprisingly, that some of these toxicants tend to be more concentrated in underrepresented groups and in groups that have less wealth and historically have been discriminated against and still are discriminated against. And so there's been really few studies looking at this. A great study done by Dr. Brad Versett and colleagues showed that you can look areas of the country with high levels of air pollution, which tend to be in underserved communities, have higher rates of Parkinson's disease. Conversely, areas of the country with lower levels of particulate matter, lower levels of air pollution, have lower rates of Parkinson's disease.
Thank you for addressing both of those questions, Ray. I have several other questions. You've answered some along the way. I do have a question that was posed by someone in a support group. Do you know if there's a connection between methyl ethyl ketone and Parkinson's?
Yeah, so you sent me that thing, and
Yes.
the root answer is that no one's researched it, but I did some research this morning, and it was crazy. So methyl ethyl ketone is a solvent, and a solvent's a chemical that dissolves things. So water is a solvent; it dissolves salt and sugar. You put salt or sugar in water, and it dissolves; it disappears. Wonderful little thing. You put trichloroethylene as a solvent. You put it around grease, and the grease melts away. And methyl ethyl ketone is another solvent. And so been very few studies of Parkinson's disease. But it turns out, my guess is it's used in similar settings as, for example, used in the plastics industry. My guess is it's also used in areas where trichloroethylene or perchloroethylene are used. So I would wonder if that person was exposed to trichloroethylene and perchloroethylene in addition to methyl ethyl ketone. And it appears, at least in some literature, that methyl ethyl ketone may exacerbate the effects of other solvents on neurological conditions. In and of itself may slow nerve conduction and might be a cause for diseases of the nerves in the periphery that might cause numbness and tingling or weakness, for example.
Thank you for exploring that. And how about the one other question from a different support group member, enriched uranium?
Yeah, so another thing I knew nothing about. Many people may know that uranium is radioactive. It gives off varying decay products, including radon. which can evaporate from the ground and enter people's basements, for example, and it causes lung cancer. But uranium also appears to be neurotoxic as well. Again, I knew nothing about this until this morning. Thank you for the information. And it appears to be more, people get exposed to it in mining. So I don't know if this particular support group member was a miner or maybe had a family member with miner. And so miners are exposed to heavy metals. Turns out miners have a 4 times the risk of Parkinson's is quadrupled among miners in research done by Dr. Caroline Tanner and others. So I'd worry about exposure to other metals through mining that might be. If you have additional questions or you have additional stories, I'd love to hear from you. I'd love to learn from them. You can just email me at info@endingpd.org. I read almost every email that comes into me. And if you send me something, I will usually respond to it. And if you can't afford a copy of the book, we'll send you a free copy of the book if you email us just your mailing address, again, at info@endingpd.org.
Thank you, Ray. And Ray put that in the chat as well. Before we open it up to other questions, well, two additional questions. Is there a particular place that you would recommend someone go to kind of advocate for, the reduction, ideally the stoppage of these harmful chemicals?
Yeah, so the best thing that's happened since our book came out was the formation of the PD Avengers. So the PD Avengers is a global grassroots organization organized, run by, led by people with the disease, led by Larry Gifford, Dr. Sonia Mather, and Tim Haig. All live in Canada, all have Parkinson's disease. Nearly, I think, over 8,000 members, over 100 different countries, over 100 different organizations. So if you haven't joined the PD Avengers, you should join the PD Avengers. It's free to do so. You can do it like right now while we're talking. I'll put their website is pdavengers.com. So that's the first thing that I would do. I would then, because of advocacy, people may have known that President Biden signed the National Bill to End Parkinson's Act just last month, which requires the federal government for the first time to come up with a national plan to prevent and end Parkinson's disease. That's because of great advocacy efforts by the Michael J. Fox Foundation, led by Ted Thompson and others, including Congressman Gus Belly-Rakis from Florida and Congresswoman Jennifer Wexton from Virginia, and Congressman Tonko, I can't remember where he's from, that did it. And you should tell your legislators to ban paraquat. You should tell your legislators that the EPA should implement its proposed ban of trichloroethylene and perchloroethylene. The more people make their voices heard, the more change will happen. And the more aggressive they are with their actions, the faster that change will occur, the faster we create a world without Parkinson's for our peers and for future generations. Thank
you. And that goes along the lines of my last question, is there hope? And I think you've given us some hope and encourage everyone. Yes, go ahead.
We live in a world free of typhus. We live in a world free of yellow fever. We live in a world free of smallpox. We live in a world where polio is almost non-existent. We live in a world where drinking and driving is socially unacceptable. We live in a world where HIV is decreasing, not increasing. These are all gifts that we've received from previous generations. We have an obligation to receive a gift, and we have an obligation to reciprocate. It is time that the Parkinson's community says that enough Parkinson's disease, we've had enough of it, and that we can prevent this disease for our peers and for future generations. And we need to do that. We need to take that responsibility ourselves and take actions to prevent this by eliminating, reducing exposure to certain pesticides, dry cleaning chemicals, all for dry cleaning chemicals and degreasing chemicals and air pollution. If we do this, fewer generations will suffer the indignities of Parkinson's disease. And if we answer what the root causes of Parkinson's disease are, if we identify clearly what the root causes of Parkinson's disease are, the faster we're going to be able to identify new treatments and even potentially cures for the disease. Because once you know the cause of a disease, it's much easier to develop a treatment or a cure for the disease. We've seen that for peptic ulcer disease. We've seen that for HIV. We've seen that for hepatitis C. Once you identify the cause of a disease, it's far easier to identify highly effective treatments for it. Indeed, I can't think of a disease that we can cure medically where we don't know its root cause. And so we know that the root cause of Parkinson's for the vast majority of people is not genetics. We know the root cause is not longevity. You don't just put mice in the laboratory. They don't spontaneously develop Parkinson's disease. It's chemicals in our food, water, and air. Sooner that we identify those, and I think we have a really good idea what they are, the sooner we create a world without them, and the sooner we get highly effective treatments for those who've already been exposed.
Thank you. Do you feel that, this is my last question, why do you think there are so many less studies regarding the environmental contributors versus genetics and other factors? Why isn't there more research being done?
I think we're living the wrong paradigm. The paradigm that we're in medicine is that genetics is the underlying cause of disease. And, since we identified the structure of DNA in the 1950s, Dr. Rosalind Franklin, Francis Crick, and James Watson, and others, we've been searching for genetic causes for all diseases. And there are genetic causes for many rare diseases. Huntington's disease, which I spent a decade working on, cystic fibrosis, some cases of breast cancer, some cases of Parkinson's disease. But in general, genetic causes are common for rare diseases or are rare causes of common diseases. If they were common causes of common diseases, they would have long been since screened out. And the vast majority of common diseases, heart disease, cancer, Parkinson's disease, Alzheimer's disease, are largely driven by environmental factors. If we change our environment, we change the diseases that we suffer from. And we've gotten rid of a bunch of infectious diseases in the past. We should now get rid of a bunch of chemically induced diseases. Just like, we don't use DDT anymore. We don't use asbestos anymore. We don't use lead anymore. We know that chemicals in our environment cause disease. Why would Parkinson's disease be any exception to that?
Thank you. Let's open it up. There already are a few questions. Please type them in the chat box. I'll read the first one to you, Dr. Dorsey. Why do neurologists not do any tests for toxins? Can you detect any of these toxins in your body and detox any of them out of your body besides taking the steps to minimize your further exposure?
Yeah, that's a great question. I spoke with Dr. Caroline Tanner yesterday when I was just asking, why don't we have assays? We test people for everything else known to man. We spend lots of money on imaging tests. We tap people's spinal fluid. Why aren't we measuring for pesticides in their blood? Why aren't we measuring for trichloroethylene in their blood or urine? It turned out 1990s, 3/4 of Italian men had trichloroethylene in their blood and urine. If we identified that you had trichloroethylene in your blood and urine, wouldn't we then ask, where is it coming from? And then once we ask, where is it coming from, wouldn't we seek to minimize your exposure to the cancer-causing chemical? I think we're just missing the boat on this, and we just need to reorient the field. We need to reorient the expectations of the public to be doing testing for identifying the underlying causes of many of these diseases. Some of these chemicals dissolve in fat. Many of you may know that your brain's a fatty organ. It's covered in fat, and it appears that that higher levels of some of these chemicals like DDT in the fat are likely associated with increased risk of developing Parkinson's and other diseases. We should be doing it. Now, how do you get rid of it? I think we should be screening people. Why isn't that part of your, if you're getting your screening for cholesterol, I'd much rather have a high cholesterol level than a high trichloroethylene level. And so I think if you found out I had high trichloroethylene, I would want to know where that trichloroethylene is coming from quickly so I could reduce my exposure and decrease my risk of cancer. After the chemical's been exposed, 20, 30 years ago, I think it's hard to undo the damage that's been done. Almost no one's done studies to do it, but that may not be the case. So there's a class of drugs called LRRK2 inhibitors that are aimed at the underlying genetic cause of Parkinson's disease, the most common one, LRRK2. It turns out that trichloroethylene and that genetic mutation both increase the activity of this protein LRRK2. So it might give us a sense of that these drugs might be especially good for people who got Parkinson's disease due to trichloroethylene, but just no one's looking at this at all. And if you don't look, you won't find.
Another question, thank you. What prevents some people who are exposed to these toxins from developing PD?
Yeah, great question. So only 10% of smokers get only 10% of smokers get lung cancer. So there have to be other factors that determine why people exposed to a certain chemical or toxin develop the disease and why they don't. In fact, only a minority of people exposed to anything will develop the disease. I mean, just think like just came through a COVID-19 pandemic. We were probably all exposed to COVID hundreds, if not thousands of times, but only a few times did any individual of us get sick. Many of us have smoked cigarettes and haven't developed any adverse consequences of it. I think there are three major reasons why certain people get the disease and why they don't. One is exposure. So for how long were you exposed, at what level, and when were you exposed? I think people who are exposed earlier in childhood, even in utero and in the mother's womb, have higher risk for developing the disease than people who are exposed later in life. Second is interactions. What are the interactions with the genetic causes of disease? So 15% of people have a genetic risk factor, and almost all of those have been identified to have environmental interactions. What are interactions with the environment? So are you getting exposed to pesticides and head trauma, for example, which have a synergistic amplification of the risk? And a third interaction, I think it's just chance. I think some of us just get bad luck. I think that's really important. Like for lung cancer, why do some tumors grow out of control and why are some controlled and cleared? I think we misfold these proteins probably a fair amount, and only in a small minority of cases does the misfolding get out of control. And then three, I think there are some modifiers. And these modifiers are exercise, diet, sleep, diabetes, wide range of other conditions, perhaps sex. That explain why certain people get the disease and why some don't. It's probably unknown. If I should say a fourth one, we just don't know.
Thank you. So that may explain why two people that maybe grew up in the household may have been exposed to the same, say they grew up on a farm, that's the same pesticides, but one develops Parkinson's and one doesn't.
And we know that, just even a household of smokers, some people get Parkinson's, lung cancer from secondhand smoking, some don't. Some people with smoke get emphysema, some get lung cancer, some get heart disease. I don't know the answer to that. I don't think we know the answer for Parkinson's.
But the healthier choices you make.
Yeah, your health is determined as a function of your environment, not your environment today, but your environment in the past. So we need to create healthy environments. We do this for our kids. We do this for pregnant women. We intuitively know that's really important. Pregnant women aren't exposed to alcohol and a wide range of other chemicals. We should be really, really vigilant on that for Parkinson's.
Thank you. Martha was asking, how do you spell those chemical compounds?
I'll put it in the
okay. And I know 2 out of 3, but the P one I wasn't sure of.
So trichloroethylene, perchloroethylene, and paraquat, and I'll put I'll put a couple articles in the chat as well.
Thank you. Why isn't there better regulation of these chemicals in the US or worldwide?
I don't think we're demanding it. We need to make our voices heard. Politicians are reactive. Politicians react to what we tell them to do. Politicians rarely lead. Rarely do something de novo that isn't in response to something. And HIV is a great example. And initially, the federal response to HIV was to blame the victim. And it was only when HIV activists said silence equals death, and they found their voice, and they agitated, and they made government respond. It's the same thing in Rochester, New York, home to Susan B. Anthony and Frederick Douglass. And Susan B. Anthony, who's responsible for women having the right to vote in the United States, had 3 things. She said to organize, agitate, and educate. And, she agitated. She voted in elections and was found guilty of voting in elections. You were found guilty of voting as a woman in the United States and was fined $10. She refused to pay the $10 fine. And we have women's right to vote since 1920 because of people like Susan B. Anthony. If we don't agitate, if we don't call attention to this, if we don't say, hey, I got Parkinson's disease because of exposure to this chemical. Michael J. Fox himself has said, I got exposure to, thinks he has Parkinson's from exposure to some kind of chemical. We should find out what that chemical is and eliminate that chemical. What greater legacy from Michael J. Fox than to say we got rid of the cause of Parkinson's disease from Michael J. Fox and others. So why aren't we doing this? And I think we just haven't found our voice. Once we do, we will change the course of this disease. We're beginning to do it, but people need to speak much, much louder.
Thank you. And let's all encourage everyone to find their voice. I'd be glad to be out of a job.
I'm waiting for the day.
It seems as though young onset PD diagnosis, the cases are rising. Do you think it is because we are able to identify sooner or something else?
Yeah, I'm sure, identifying sooner is helpful, but if you look at like multiple sclerosis and Parkinson's disease, we're identifying way, way, way more Parkinson's than multiple sclerosis, even though we have a really sensitive test for multiple sclerosis called an MRI, which is helping us identify it. I think we're just getting exposed to these chemicals in greater amounts. Paraquat use, for example, in the United States is not decreasing. So we've known for 60 years, at least according to research done by the company itself, according to The Guardian, the company itself fed paraquat to mice, rabbits, and rats in the 1960s, and it had features of Parkinson's disease. So we've known for 60 years that these chemicals may be linked to Parkinson's disease, and use of paraquat in the United States is increasing. In fact, it's doubled in the last 5 years for which data are available. Fortunately, the EPA has proposed this ban to trichloroethylene, but 30% of groundwater in the United States are contaminated with this. There are homes in Rochester, New York. There are homes in Newport Beach, California. There are children in schools in Franklin, Indiana, that have been exposed to trichloroethylene in their indoor air. And there are people who have developed cancer, leukemia, and have died because of exposure to this chemical. And we're still allowing its use. And we haven't cleaned up the thousands of sites or even protected or notified millions of people who are living near these chemicals about the risks inherent in it.
Again, thank you. Can these chemicals be passed to a baby during pregnancy?
Yes. So that's yes. So many of these chemicals are small. They pass through the placenta and they are in the baby. And they're in children. So this woman, Lilian Calderon Garcia Dueñas, she's the Doogie Howser of Mexico. She went to medical school at age 16. So you can imagine being a 16-year-old girl, and being in medical school and what barriers she overcame. And she was really concerned about air pollution in Mexico City in the 1990s, which had the worst air quality in the entire world. And she did a study where she looked at the brains of children and young adults who died prematurely from car accidents or gun violence in Mexico. And she looked at the brains of 203 individuals, ages 11 months to 40 years old. Obviously, none of them had Parkinson's, none had Alzheimer's. But in the brains of those individuals, in 202 of the 203 brains, she finds Alzheimer's pathology, including in the lining of the nose. And she finds Parkinson's pathology in 20% of these individuals, 11 months to age 40. So suggesting that early exposure is planting the seeds for future cases of Parkinson's and Alzheimer's. Brian Grant, many of you know, former NBA basketball player, was a 3-year-old boy living at Camp Lejeune when his father, a Marine, was based there. His father died of esophageal cancer linked to trichloroethylene. And then Brian Grant, 30 years later, age 36 or so, was diagnosed with Parkinson's disease after developing symptoms while playing in the NBA. So he played NBA basketball with tremor and decreased ability to jump off his left leg. And his exposure was when he was 3 years old. So we have lots and lots of evidence that early childhood exposure is likely playing a role in these diseases.
Thank you. Do water companies have to identify these chemicals?
So we have the Safe Drinking Water Act because Rachel Carson wrote a book called Silent Spring in the 1962s, highlighting the dangers of indiscriminate use of pesticides. She didn't say pesticides are bad inherently. Indeed, pesticides prevented lots of people from getting malaria. She said indiscriminate use of pesticides, using them in your house to kill all your ants and to spray them on children on the beaches in Atlantic City, didn't make sense. And 8 years later, Republican Richard Nixon creates the EPA. Within 2 years thereafter, we have a Safe Drinking Water Act, which regulates municipal water and ensures that we have limited exposure to these chemicals. It turns out that over time, in general, the threshold for the level of these chemicals, like forever chemicals, trichloroethylene, keeps getting lower and lower. And that's why I put a carbon filter on my water, because I want to decrease my exposure to even beyond that which the EPA deems to be safe. I would 100%, if I had a well, have a carbon filter or similar mechanism on my water at home.
Thank you. Have you walked into a big box store lately and seen the Roundup stack there? Yet people think their lawn is more important than health, and complaints about regulations.
Yeah, and so I looked in my garage, and it turns out that there, I'm not naming names, there are ant killers that have pesticides in them that have chemicals that have been linked to Parkinson's disease. So I've gotten rid of most of them. I think it's just Rachel Carson had it right. It's one thing to use pesticides to decrease our risk of malaria, right? That's a nice risk-benefit ratio. It's crazy to be doing this so that we don't have weeds in our yard, or weeds on our kids' playgrounds, or weeds on our kids' sports fields. There are several studies linking, I care about Parkinson's, but there are several studies linking ALS to soccer players. And I think it's a combination of head trauma and exposure to pesticides that kids and young adults are absorbing through their skin. We're doing this also, our kids play on weed-free lawns. I mean, weed fields, soccer fields. I think kids can handle weeds in their yards and on their soccer fields.
Thank you for your comment. Can you add a similar article around PD and paraquat?
Yeah, I'm putting it in.
Or the other one.
There's one on the perchloroethylene. There's a total, I think, of one article in the entire world's literature on perchloroethylene, but the Camp Lejeune study, perchloroethylene, as you can imagine, gets degraded. Trichloroethylene, it's likely the two chemicals have very, very similar effects with respect to Parkinson's disease. This Guardian article is unbelievable. If you haven't read it, it's incredible.
And I'll make sure to save these resources, so if someone needs access to this information later, you could just email me. Why does head trauma take years to manifest?
I don't know. I think clearly head trauma is linked to Parkinson's. I think it's clearly, especially interactions with it, other chemicals, especially pesticides, are amplify the risk. In general, most of these chemicals damage the energy producing parts of cells. Your brain is only 3% of your body weight, but 20% of your energy consumption, and 75% of energy consumption comes from nerve cells. And not surprising, nerve cells have huge energy demands. Many of them are really long. They're a meter or long, and they're chock full of energy producing parts of cells called mitochondria. And all these chemicals that I've been talking about all damage the energy producing parts of cells. And I think, therefore, these nerve cells, especially the ones that produce dopamine, for example, are maybe especially susceptible to that. How head trauma plays a role in that, I am less certain. Head trauma also increases energy demands, and that may be it, but I'm not sure why. I would just say it takes a while for these nerve cells. By the time you're diagnosed with Parkinson's, 60% of these dopaminergic nerve cells have died off. That in general takes time for that to take place.
Thank you. What do you think about stress levels in being stuck in flight, fight, and freeze for an extended period of time as coexisting root causes of PD?
Being stuck in what again?
Well, flight, fight, and freeze. It says fright, but it's fight. There's a lot of F.
Yes. So I don't think stress in and of itself causes Parkinson's. I think you don't stress mice and they don't spontaneously develop Parkinson's. It's quite clear that stress makes Parkinson's worse. So I would put that in the modifier category, and we should, reduce stress so that people can live better lives with Parkinson's disease and live better lives in general.
Okay, thank you. Our Southwest Pennsylvania region was known to have the highest rate per capita of people with Parkinson's in the U.S. Our records for this being maintained and updated.
I'm sorry, say it again. What was the question?
Yeah, sure. Are there records being maintained and updated regarding incidences of Parkinson's, especially in Southwest, Western Pennsylvania? That you
It
know
is
of?
crazy how few studies we have on the incidence, the number of new cases of Parkinson's or the prevalence of Parkinson's in the United States. The best way to do this is to take a community, say Pittsburgh or some suburb of Pittsburgh, and go around and identify people who have the disease with questionnaires and examinations. The last time that kind of study was done in the United States was in the 1980s. We're just not investing. It's like we don't care how many people have Parkinson's disease. We don't care to know. If we don't care to know how many people in Western Pennsylvania and Pittsburgh have Parkinson's disease, how are we going to ever determine if that number is decreasing or increasing? How are we going to ever know if we're succeeding or failing? We're just not doing the basic levels of investment necessary to answer the important questions that everyone's asking.
Do you think the national plan will address this, Dr.?
I hope so, and we should make voices heard. And there's a federal membership, and there'll be an advisory council made up of people including Parkinson's, including caregivers, including neurologists, and the like. And we should be really, really mindful about who we put onto that committee. But there's lots of things that we should be doing right now to address Parkinson's disease that we're not.
A few more questions. Thank you. Are there fruits and vegetables that we should avoid due to holding in pesticides?
So there's the environmental working group, EWG, which puts out like its dirty dozen and stuff like that. And so you can put that out there. Paraquat is used on corn, soybeans, cotton, and vineyards. You can imagine the French care about their wines, and it turned out the equivalent of the Consumer Reports of France tested wines, including organic wines, and they found residues of pesticides in nearly every bottle of wine that they tested, including organic wines. We're being exposed to these chemicals without our consent and generally without our knowledge, and with the erroneous assumption that these foods are largely pesticide free. Even organic produce has pesticides on it, in some cases unsafe levels. Even the cereal that you feed to your kids has pesticides in it. I think we need to be a lot more vigilant and make our voices heard and say this is just unacceptable. And forget Parkinson's. Listen, rates of cancer in the United States for people under 50 is increasing at the same time smoking is decreasing. Why is that? And it's not like our genetics have changed in the past 25 or 50 or 100 years. And this is not aging, and it's not screening, because most cancer screening is not done until age 50. If you don't care about Parkinson's disease, you probably care about cancer at least, and we should be asking that same question of cancer.
Thank you. This is a comment. I was repeatedly temporarily put to sleep with either chloroform or ether when I was just 3 years old. I grew up in becoming an analytical chemist. I was exposed to quite a few solvents and lab chemicals. I'm probably fortunate not to have early onset Parkinson's.
Yeah, I'd probably be less concerned about the anesthetics. The people who I actually worry about the most anesthetics are the anesthesiologists who were using tricloethylene as an analgesic to reduce pain in pregnant women. It was widespread until the FDA banned its use in 1977. I'd be worried about what you might have been exposed to in your chemistry lab, I think, a little bit more than the anesthetics.
Thank you. Then why, this is kind of goes with your statement before, then why isn't getting rid of pesticides the first step towards the national plan to NPD?
You're asking, listen, I think the first response to any crisis is to contain it, right? If you have a fire in your house, what's the first thing you're going to do? You're going to shut all the doors, close all the windows, and get the heck out. And we're not doing that for Parkinson's disease. I think we know what the likely causes of Parkinson's disease are, and all we're doing is adding fuel to the fire. The first response is to contain it and minimize exposure to other populations, and we're failing to do it. You think of whatever crisis you want to come up with, a shooter, an infectious disease, as you contain, quarantine, and get everyone out and reduce future exposure. and we're not doing that. We're only planting the seeds for future cases of Parkinson's and increasing numbers around the world. And it's incumbent on us. Listen, we are educated. You've now been educated for the past hour. We need to make our voices heard so future generations are spared the indignity of this disease.
Absolutely. A few more questions. Do you have a few more minutes?
I got a couple more minutes.
Okay. Is there any connection, thank you, between Parkinson's and chemicals in plastics?
So there have been one study that came out showing that plastics and animal models, microplastics, can produce a Parkinsonian disorder in mice or rats. Your earlier question, methyl ethyl ketone is used in plastics. So if you work in the plastics industry, I'd be worried about what chemicals or solvents you might have been exposed to. I can't recall if trichloroethylene was used in the plastics industry, but 10 million Americans are estimated to have worked with it. 1 in 12 workers in England are estimated to have worked with trichloroethylene. So I get really concerned when I hear about people working with chemicals and industry exposure and then developing Parkinson's. My first thought is around trichloroethylene and perchloroethylene. It's like painters, printers, varnish workers, furniture workers, you name the industry. And one of the articles in there, we have a table and it's like, 25 different occupations where trichloroethylene might be used.
Okay, looks like 2 more questions.
And if you've used it and you gotten exposed and you have a story,
yes.
tell me your story, email me.
Yes, email Ray. Are you, I'm going ahead one question and then back. Are you aware of any effective natural weed killers?
Yeah, so it turns out that plants don't like be eaten either, and so they produce their own pesticides. Turns out chrysanthemums produce a class of pesticides called pyrethins. Another plant, I forgot its name, produces a chemical called rotenone. Those two also likely cause Parkinson's disease. Indeed, the researcher from Pittsburgh who identified that chronic exposure to rotenone causes Parkinson's in mice, Tim Greenemeyer, he himself has Parkinson's disease, he thinks possibly due to inadequate protections to it. So we've done the experiments on mice, we've done the experiments on humans. We should quickly realize that these chemicals, whether they're natural or synthetic, if they damage the mitochondria and they're inhaled or they're ingested, I get really concerned about their role in Parkinson's. There's something called integrated pest management. There are lots of techniques there without using pesticides to handle your yards and golf courses and sports fields. I've learned more about horticulture than I care to learn as a neurologist, but there are lots of things that people can do. You can just minimize the use of your pesticides instead of spraying it once a week, once a month, once a year, not be around, take you and the dogs and go away for the weekend. I mean, tons of things that people can do to limit their exposure to these chemicals.
And we can let the weeds grow.
We can let the weeds grow.
Yes. One last question. Is there testing to determine how you got Parkinson's?
No, and now every time I see a new patient with Parkinson's, I spend 5 to 10 minutes trying to figure out why, and the vast majority of times I can. So I always ask people obviously about family history, but more importantly, I ask them, did they grow up on a farm? Did they grow up with well water? Did they grow up with pesticides being sprayed nearby? So it turns out on paraquat, you don't necessarily need to have worked with it or actually lived on a farm. You can just simply live or work near where these pesticides are sprayed, and your risk of Parkinson's is doubled. I also then ask people a ton of questions. Did they work with chemicals or solvents and that? Did they work in the military? And then I ask them about where they live. And then I just do simple things like I Google where they live and I put in trichloroethylene, which I spelled in the thing. And I try to find out if there are contaminated sites near where they live. And you can find out causes. The vast majority of people with Parkinson's disease, I've been able to find an environmental exposure. I can't prove that exposure caused their disease. We need more details for that. But I think most people you're hearing, you got questions, there's 5 I haven't even answered. It tells you that people know that they've been exposed to these chemicals, and methyl ethyl ether and methyl ethyl ketone and uranium. New ones for me, but it could be markers of other exposures.
Thank you very much, Ray. Any parting words to give us some hope?
Listen, if we identify the causes, we're going to be able to identify effective treatments and maybe even cures for it. We did this with peptic ulcer disease. I know some of you might remember bleeding ulcers. People thought that was due to stress. They found out it was due to bacteria. And now we just give people antibiotics and no one ever dies. Very few people die from peptic ulcer disease. There was a virus called hepatitis C. It was used when shortly before I was in medical school. It's called non-hep A, non-hep B, because I didn't even know what it was. They found out what causes it, and now there's a pill that cures people from people who have hepatitis C. They don't need liver transplants anymore. HIV, we identified its cause. We've taken measures to prevent it. HIV may disappear as a major clinical entity in our lifetimes, knock on wood, because of a focus on preventing it and preventing its spread. We can do the same thing with Parkinson's. We identified the underlying root causes of the disease, which are likely in our environment, likely in our food, water, and air. We will accelerate the time to getting effective treatments for the disease. We'll slow the rate of progression for people who already have it, and will prevent future generations from ever getting the disease. As a neurologist, as a member of a disease community, I can't think of a better gift than to spare future generations a terrible suffering of Parkinson's disease.
Thank you again, and I encourage everyone to take action. I do have all the resources. I'll send a follow-up email with all of those. Thank you so much, Ray. Yes, perhaps to our conference. We'll talk.
And if you can't afford the copy of the book, all the proceeds are going to efforts to prevent and end the disease. You can buy it on Amazon. You can get it in the bookstore. You can get it in the library. Not likely in a bookstore, but online. Thank you. Thank you, Casey.
You're welcome, and thanks everyone for joining. Goodbye for now.